Okay, let's make a start. So, why are you here? What is it that you're wanting to perhaps achieve by coming on to learn EMDR? Anybody want to share that? Anybody want to say any? Fiona, you're. I know you. I know.
Yeah. As you know, I did this course many years ago as part of my practitioner course, and when it was at that point, and it was one that I did that I was interested in, but circumstances took it, and I never actually used it. And I'm aware that EMDR is used quite a lot now. A lot of people, it's used a lot on social media. So having done the integrative psychotherapy module last year, it is one that I thought perhaps I should revisit it. And again, because I now do all my sessions online, I'm not familiar with the butterfly hug one. And so for me, it would be updating the knowledge that I have on it and adapting it for, dare I say, modern days, modern style.
You can.
And when I did this, I can't remember whether it was 2017 or something like that. It was a while ago. It was certainly well pre-COVID, and it was in person. But I don't think the same emphasis was on it for the other adaptabilities. When you're saying they're working with motivation, working with weight loss, and that it was trauma, and it was heavy trauma.
Yes.
So that's a refreshing look on it now. But again, it's something that I know in the past, people that I've been speaking to said, oh, I really want to have EMDR. But being a bit old school, and it ties in with what you were saying there, Peter, the stabilization, I'll say it's not a first stage. There's other techniques first. And I think that's the thing. There's a lot that people will jump on the bandwagon and just say, all right, I've heard this, I want this new shiny tool, I want a new toy. And it's not that, but it's seeing how it fits in there. I particularly like how you set it out, Peter, how you started in the process, but then about the bubbles, because there's a lot more coming into, the somatic work, and that it will then, it can then release it another way. And as you know, having been physical therapist for the best part of 20 years, I have seen that release myself in people. So yeah, that's where I was coming from, apart from the fact that you yourself that was running it. So I couldn't open it on and do another hour. But no, from that, it's refreshing to see the other uses of it, but also remembering that it is a very powerful tool and it will release a lot of things. But to have thing there that you can then fit it in with other things. So yes, I'm interested in perhaps doing it again.
I think what you've also said there is the fact that we are more aware of trauma. There is more trauma out there. And I think it's really useful for therapists of all persuasions. Originally we were only training in hypnotherapy. We now train across a lot of different modalities. The one consistent thing is once people get to know a therapist and trust them, you often find they'll then come out and say, well, actually, I was abused. I was in a terrible accident. I had this happen to me. They want to come and see you because you're you, but if you're not trauma trained, it can be extremely problematic. What we give within this is, yes, you mentioned the deep, horrible traumas, and I have no problem telling you about some of the work that I've had to deal with. We can't pull punches. We're very open and very honest about it. But I can tell you that because we work people through it. It's scary thinking trauma. Horrible. Yes, it's a challenge working with it, but it is not dangerous. It is not difficult, in that if you follow the proper protocols and what we teach and what you're taught about it, you will help clients get through that. But as you said, we've also got the other protocols. People who are doing smoking cessation, for example. We all know what it's like with regard to smoking cessation. It's what I built my original hypnotherapy practice around. And you always have those smokers who get a blockage, who can't do it for one reason or another. EMDR provides a wonderful tool, a resource that steps away from the hypnotherapy modality into another one that really can help smash through. Can't guarantee anything, but you can take back, you can find different thoughts, elements of identity come up with, smokers identify with their cigarettes. I'm Peter Mabbutt. I'm a drug addict. Yes, I used to smoke. That's what I mean by drug addict. I smoked. I was hooked on cigarettes decades ago. Can't remember what it's like now, but I knew back then it was part of my identity. If you don't deal with that, you've got problems. Likewise, weight management, the eating disorders. More and more people are presenting with eating disorders because they go on YouTube and TikTok and these other social media sites and learn how to have these eating disorders in order to cope with anxieties. And that's where, again, EMDR comes in really, really effectively. Deal with the underlying issue, the traumatic cause of the eating disorder, then the removal of the behavioural elements really quite straightforward. And I put straightforward always in quotes because don't make it, it's not easy, but there is an awful lot EMDR can do, and we're constantly updating it all the time. And also, just so you know, it was part of our the course that we teach now is an evolution of the course that we taught as part of our master's degree programme with a university in the UK, University of West London. So we don't run that anymore because of funding issues with the university. But it's an evolution of that. We're always evolving and bringing new ideas into it. And everyone who teaches on the course, we all use EMDR regularly. We're all EMDR clinical supervisors as well. So you kind of get some really good experience, and that's what we like to bring in. The other element we want you to be able to feel comfortable doing is to be able to bring in current cases, keeping it confidential, of course, just so that, we're practicing the recent trauma protocol and you think, oh gosh, I've got a client. I wonder if it would fit with this. And we will discuss around your life cases as well. Yeah, Jessie.
Yes, Peter, how are you?
I'm good.
So yeah, I completed the ABPP, and as you know, I just graduated not long ago, and I'm also setting up my therapy, and it will take time for me to start to to get clients. So my concern is okay, so I've done ABPP because I know that the full course is part of the advanced diploma. But what if right now I'm doing the ABPP, will we actually get you are specialized in ABPP because you completed that, or you are considered you are EMDR specialist once you therapist, or I have to take all the four only?
No, each course is a course in its own right. EMDR is a course in its own right. You come out with a qualification with EMDR. ABPP, course in its own right, qualification there. But EMDR, ABPP, you'll see the link between the two. Throw ego states into the mix. Ego state, it's a course in its own right. Don't need to do anything else. You come out as an ego state therapist. But then you see the link between EMDR, ABPP, CBT, if you do that, comes in. You'll see all the links. So there's a lot of linking between everything, yet they are courses in their own right. So I never thought I would be bringing EMDR, for example, which was the first non-therapy psychotherapy I trained in outside of hypnotherapy. I never thought I'd be bringing those two together, and then very quickly, and if you've ever experienced EMDR, will recognize the altered states that people go into just by following the eye movement processing. So there are links all the way through. You don't have to have the links to be really effective, but when you see the links, you add another layer of effectiveness to what you're doing. We're not about, you have got to stick rigidly to this, and this. Rigid boundaries make for a very rigid therapist. We'll teach you the safety, that's paramount, but we'll also teach you the flexibility within those boundaries. So there are elements like, for example, if I'm taking a case history with somebody and a lot of anxiety is starting to come up, I'll just say to my client, they know I do EMDR, I'll just say, I want to just stop you for a moment and just focus on that feeling that's coming up. And as you do, just focus all of your attention, focus your eyes on my fingers without moving your head. just follow my fingers wherever they move, thinking about that feeling. And so I bring in at that point a bit of EMDR, see what comes up, not just to experiment, because something's there. I can then find out, and then maybe just in hypnotherapy use it, maybe go into something else. So it's
Okay, yeah. So I got it, because I just want to, I may not like taking, the consistency, or I may, because, I need to build this the business as well. So I guess that, I also have to put some time. So I think EMDR will be very, because I think everyone actually talks about trauma, and I think the benefits of EMDR is, WHO actually recognize that. And, I think so I think being registered as a EMDR therapist actually put you like a advantage. So that's why I'm actually keen to do that as well. But I'm also like thinking this, I may actually ask about like a bit more, like now I'm actually hypnotherapist, but there's also psychotherapists. And coincidentally, I was talking to a friend of mine, which she just shared that apparently her eldest daughter is actually have bipolar disorder. And I have my friend, which a good friend of mine, which her brother also diagnosed with bipolar disorder. Then I'm just out of curiosity, I'm like, okay, so can hypnotherapy helps? And then I think that there's some research, and they say that it's actually better to have the hypnotherapy combined with psychotherapy to deal with the bipolar disorder kind of stuff, and it's more effective. So I'm just like wondering, what will be like the difference between hypnotherapists and psychotherapists, because I'm just starting, and then also, and what will be being advantage of psychotherapists bring into the table when you have and maybe what kind of patients we can or clients that we can actually take on, because the hypnotherapists I cannot take on certain clients, but because with the psychotherapists I can take more on clients and so on.
It is. And look, first and foremost, hypnotherapy is a psychotherapy, and we're very passionate about pushing that realization. It's not something we've invented. I mean, psychotherapy is a coverall name for CBT, ACT, Jungian analysis, Freudian analysis, psychodynamic approaches. All of those things come under that broad spectrum. As a psychotherapist, and especially what we're promoting, which is the integrative psychotherapy, which is increasingly being shown to be effective. You just mentioned hypnotherapy and psychotherapy for bipolar, and that's integrative psychotherapy. That's what we call integrative. Time and time again, integrative psychotherapy is being shown to be effective with all types of presenting issues. The research is very, very strong on that, because it recognizes different approaches for different people from different backgrounds. And that's what this does. So you have, yes, you've got a greater spread of tools to work from, but you've also then got a greater spread of tools that allow you to work with something that perhaps hypnotherapy can't work on. With regard to things like depression, you can't use analytic psychotherapy for that. So it's been shown to be very, very, very challenging. You've got hypnotherapy plus CBT, two working together, integrative, are really good at helping alleviate depression. EMDR plus other approaches can be used with depression to make it more effective. So you don't have to go under one particular discipline and advertise yourself there. You go under the discipline of an integrative psychotherapist, and you've got greater approaches to work with a wider number of clients. And, there is still the age-old prejudices, which I've never understood about hypnotherapy, even though when you look at EMDR, you're in an altered state of awareness, swinging pendulum, hypnosis. With EMDR, you've got the swinging pendulum. They go into altered states. I feel okay. So basically what I'm saying here is more approaches to work with wider range of symptoms, to be able to attract a wider client base who might not really just want hypnotherapy. They might want EMDR or ego state work, CBT, whatever it might be. So, and it gives you a greater set of choices to look at your client, see who that person is, understand them, and then from your toolbox you can find the most appropriate tools for that to work with. So many a benefit with with regard to that. Even working within medicine, with the whole idea of social prescription coming in, which is now fully recognizing the role that psychotherapists have within medical recovery. So we've got that element there. Okay, thank you, Jesse. EMDR, I think we're all aware of what the challenging situations we are facing around the world at this moment in time, and the challenging situations that the world has been through, and without doubt the challenging situations that the world is going to be going through at some point. It's part of society, and unfortunately not the most pleasant part of society, but it is a part of society. Basically, EMDR is a very powerful approach to managing and working with trauma of all different types, and we'll explore a little bit more about that. It's a really wonderful tool that has been recommended by the World Health Organization, totally, especially as a first line of defense when working with trauma. But the thing to remember is it's not just trauma that EMDR works with. It's very versatile, it's a very adaptable very adaptable technique. And I've used it with trauma. I am a trauma therapist. I use it extensively with trauma. I also use it with weight management, with stop smoking, with addictions. I use it to help motivate people. I use it as a motivational tool. So it's gone beyond its original designation of being a trauma approach. And EMDR, the words EMDR, or the letters EMDR, it's eye movement desensitization and reprocessing. The one thing to remember, it's not just eye movements anymore. The original, when EMDR first was discovered by Francine Shapiro, the story is she was working at the Veterans Administration Hospital in America with Vietnam War veterans, and she was out having lunch and walking through the hospital grounds. There's a park there, and she was mulling over a particular problem that she was thinking about. And as she was walking under the trees, the light flickering through the trees were making her eyes move from left to right. She was responding with her eyes moving left to right. And what she found was that as her eyes were moving, the thoughts she was thinking through started to process quite quickly. And being the excellent researcher she was, unfortunately no longer with us, she went off and basically started to work with the concept of eye movements to help reprocess thoughts. You originally got EMR, eye movement reprocessing, and then she realized as well that with the eye movements came a desensitization to emotion. And that's where eye movement desensitization and reprocessing came from. Very much a standard term. Fortunately, unfortunately, depends how you look at it with regards to the letters EMDR. We also then discovered that it isn't just eye movement. It can be auditory stimuli, or it can be tactile stimulation as well. It seems to be left and the right stimulation is what's important here, but the name EMDR got basically stuck with us. So that's a very brief potted history of where it came from. And our training, one of the things I think that makes our training different, I mean, we follow the standard Francine Shapiro protocol and then the other protocols that come around, so you're getting the proper protocol, is that we make it in an accessible way, a fun way of working with it, learning it. Don't get me wrong, working with trauma is not fun, but learning EMDR can be fun. We're also very open with regards to the fact that EMDR, it is a therapy in its own right, but as you're all aware, I hope, if not, you will be by the end of this, we're very much into the concept of integrative psychotherapy. So it is a really good therapy that integrates with so many other different psychotherapies that are out there. So one of the things that we do is we look at the different protocols, we look at the different therapies that are out there, and we focus on EMDR throughout, but we talk about how it can be integrated with a wide variety of other psychotherapies. And in the spirit of integrative psychotherapy, we will talk about how you can take it and adapt and evolve it for your own personal practice with your clients. So that's one of the things that we're doing with EMDR. And the core of EMDR is something called the Adaptive Information Processing Model, the AIP. And just so that you're aware, if you are ever looking at some of the older texts on EMDR, you will see the AIP referred to as the Accelerated Information Processing Model. But a little while ago, they decided it wasn't accelerated, it should be called adaptive. So there is a slight change. Basically, what they're saying is when we have an issue, it gets blocked in our mind. You know, a lot of people, we can have an issue, we mull over it and it gets processed out quite naturally. Traumatic, untraumatic, there's a natural processing that goes on. People who present to the likes of us for psychotherapy of any description, when they come in, some of them traumatized, stuck with phobias or PTSD, CPTSD, whatever it might be, the processing has become blocked for one reason or another. That's something we'll explore, and we'll explore about other ways of blocking these blockages. But the idea is that with EMDR, we unblocking these blockages, opening up memory networks. And we do this using that bilateral stimulation, the eye movements left and right, the tapping that we can do, or the auditory stimuli that can go into the mind and into unblocking things. So we have that element that comes in. Doing this with bilateral stimulation, what it seems to do is it targets the blocks and it opens them up and allows a gentle free flowing of material to come out. It's the nice thing about EMDR, it can be quite a gentle way of processing. Don't get me wrong, there are reaction, there's catharsis that comes, but there is a gentle opening up of this on this journey. And what we found as well is it's not just targeting belief, there's a neurology that it targets that helps to open this up, but also it brings in the concept of somatic release. So we're looking at not just the brain, the belief structures, we're looking at the emotional elements, we're also looking at where things are held in the body. And as anyone who has ever worked therapeutically with body and with touch, the somatic approaches, knows that we can massage a certain area and then suddenly there's an explosion of emotion as that little area of the body that's holding on to the motion releases what's there. So what we're doing, we've got a processing of an emotional resolution and also integrating healthier beliefs. You'll see we work with feeling, belief, body memory with this. So what we're looking at, let's say the emotions. When we look at a trauma and when it gets held in place, blocked in processing, various elements of it will split off. You've got emotions that will split off. You've got beliefs that will split off. Painful perceptions that will split off. And also perceived meanings. Images will come into this as well. You know, when we talk about people having flashbacks, stuck image, you know, the image comes up or the video in inverted commas comes up, and instead of me looking at my screen and seeing my PowerPoint, you guys on this side, I see that war zone that I was traumatized in. I don't see anything else. Defense mechanisms come in, push it all away and pats it down, locks it away. Hurrah, it's all really nice. Okay, it never is. We have to process trauma, process it all. And it, as I said, it locks elements of these away in different packages in your mind and in your body. You know, I've worked with people who have seemingly processed a trauma and they've got a physical pain, or they have an ache, or they have a particular sensation somewhere in the body. And I can use EMDR to get them to focus on that, do the eye movements or whatever approach I'm using, and that can then release those emotions, whatever is trapped within the body. It's quite amazing to see that. They can think they're okay, but they've got this ache, focus on the ache, process it through, and bang, another element of the trauma comes out. So, and it's the beliefs as well. When we are connected with the belief system that holds these feelings in place, the trauma in place, we need to process through that. We need to open up a different set of beliefs. So with EMDR, we look at an image, and I just say image, I don't mean picture. Image can be a feeling, image can be a picture, it can be a drawing, it can be a shape, it can be something. When they think about their traumatic experience, what image comes into their mind? We find out what emotion is attached to that image. We find out a rating of how strong that emotion is. We also look for beliefs, negative belief that's keeping everything in place, and a positive belief that they would like to believe that's realistic, but they currently don't believe. And then where this thing is felt in the body, we process all of those. So why now with EMDR? Well, you know, as I mentioned at the very start, we live in a very challenged world at the moment. We've been there for a long time. We find more and more clients presenting with perhaps more complex awareness of more complex issues with regard to their presenting problem. People are more trauma informed today than they've ever been. And so our clients are understanding that trauma is out there, and they understand that some of these feelings that they might have may present from trauma. So EMDR comes in to help work with those traumas. Now, you might not just be working with trauma. There's a whole area of potential trauma-linked elements that EMDR works with. Anxiety, very strong element there. Addiction, you know, why are people addicted? And when I say addiction, I'm not just referring to chemical addictions. I'm referring to behavioral addictions, sexual addictions. You know, there's a whole syndrome about these things, mobile phones. And these addictions all have very strong links to the neurology of what's happening in the brain. Some of you heard me say this before. The research now shows that something like a phone addiction or a pornography addiction, when you look neurologically at what's happening, you're seeing the very same brain changes you see with something like cocaine addiction. So they're very real experiences. EMDR works with all of those. So what it does is it recognizes the trauma base to this and deals with that, which then breaks the chain reaction that leads to taking a substance, carrying out a behavior to feel better, and allows us to be more regulated with emotions. So and we do have, and we have had connections with addiction centres in a variety of different places around the world who are, you know, our graduates are going in and working with the addiction centres using the EMDR that we teach, and using the skill set we also teach on our other course, the ABPP course, Addictive Behaviours and Psychological Pain course. And so they're using that there. So it is becoming a very well used or well-known therapy for working with addictions and a wide variety of other elements. So we tackle the source of the symptom. We don't tackle the symptom itself with the EMDR. By dealing with the source, you deal with the symptom, and then you might have to do something from whatever other discipline you have to deal with the behavioural conditioned responses that are there. But it goes for gold. It really does dig down. It really, you know, in that respect, it's very analytic, psychodynamic. It can be quite surprising what people see. I had a client who presented with a particular issue that she had of guilt regarding something that happened to her daughter, not her daughter, to her sister when she was a very, very young child, so like 3 or 4. For most of her life, she had held on to it because she thought she was responsible for a particular action that led to scarring of her sister. Even though she was told it wasn't, she still held on to the belief. We were using EMDR, and it went beyond that incident. That incident she had nothing to do with it, but it went deeper into an issue she had with her father and an attachment trauma element that came up. Nothing untoward with regard to sexual abuse or anything like that, or even emotional abuse, but with a detachment that came between her and her father for a variety of specific reasons. And so it wasn't what she thought. It turned out to be attachment trauma, nothing to do with the incident with her sister. She'd held on to that belief for 50 odd years, and it wasn't until processing with EMDR cleaned it out. She's now free of that element there. So we have clients actively seeking out EMDR. We've had many of our graduates who've trained, who are taking this, who are using it in a variety of different places. Some who've been, for example, coaches, taking it into the coaching environment to help break through blockages in moving forward, in improving one's self within the work environment or within one's own personal journey with work. So it comes in various different ways. We've got some people who are working with it in dental units and to help manage dental phobias and needle phobias. So very, very powerful technique. And we've got, as I say, many of our clients are actively seeking it. And one of the things we need to be aware of with the increase in clients seeking different ways of working with trauma, seeking different ways of working with issues that they perhaps may not have recognized as an issue, this is where something like EMDR comes in, because it integrates into a whole host of other tools. The prime discipline, my prime discipline is hypnotherapy. By bringing EMDR into it, ego state therapy, CBT elements into it, energy psychology. I integrate it all. They all mix and match. So I'm saying integration. Yes, EMDR is a therapy in its own right. Brilliant, hurrah. But we need to find in a process of therapy, yes, you can theoretically do it as the only therapy you use. Across the board, it's not recommended, because before you get to using EMDR, you've got to ensure the client is stable enough to go through the process of EMDR. So going through issue or going through processes such as ego strengthening in hypnosis or behavioral change, whatever your prime discipline is, you carry out some sessions of that, stabilizing the client. You bring in other change work according to the way you like to work. So by the time you get to it, they're ready for EMDR. They go through the process, the trauma processing, whatever it might be. And we could be looking at, this and this take one session, or this and this can take several sessions before you get to EMDR. It's your clinical judgment that is important here. You work with EMDR to clear out the trauma, and then afterwards, never just say, all right, it's all finished. You need to have clients coming back in. Once processing starts, it's an ongoing event. And so they might say that everything's okay by the end of one session, bring them back in for another session, and something else might have popped up that the processing has opened up. So we need to keep seeing them. Once they've gone through the EMDR, we just need to reinforce other changes using whatever discipline you like to use, and then make sure that you're looking to the future. Has the change happened? And if so, how are you maintaining that change? So hypnotherapists got pseudo-orientation in time, hallucinated age progression, the imagination of coping well with that. I will point out that you could be on here the more change work or the maintenance of change. The nature of trauma is little bubbles of trauma may bubble up once the processing is undergoing. And if it does, you may need to go back to the EMDR processing. It's the way the mind works. Remember, trauma is held on to very, very deeply and could be held on to for years. My cousin gave me permission to share his example. He lives in Australia, and he was around, obviously. He was around during the time of the Vietnam War, and he got conscripted into the army to go and fight in the Vietnam War. He basically got shot to pieces there and was sent back. Thankfully survived that experience, and in those days they didn't have psychotherapy like we didn't. Sent him on his way. He became a very good headmaster in the schooling system, worked for many years. One day he got up happy as Larry and went off to work, never got there. And so they sent out people searching for him, and they found him in his car on the side of the road. He just parked, and he was just sitting there catatonic because the trauma of his experience in Vietnam, he still doesn't know what it is that triggered it. Boom. Years and years later, suddenly came out. So the mind holds on to stuff, bubbles of it come up. So don't be surprised before you get to the final point of discharge that you might need to just go back through this little cycle before you get anywhere else. So I mentioned that there are many, many different protocols out there. The original one, Shapiro's long-standing trauma protocol one, is the basis of everything else that comes. But we have defined protocols. We've got long-standing trauma protocol, recent trauma protocol. You might be working with people who are going through ongoing trauma. There's protocols for what's known as CPTSD, so complex post-traumatic stress disorder, where you've got a lot of complexity in the trauma the person's experienced. We've got well-being protocols that doesn't need to touch on trauma at all, like the ego strengthening tradition within hypnotherapy about feel-good factors. There's a protocol for that within EMDR. There are protocols for weight management, for eating disorders. There's protocols for smoking cessation and panic attacks. We bring them all into what we're teaching you. There is a belief that EMDR is a very rapid therapy, and sometimes it can be. You can do one session of EMDR and the whole symptomology falls apart. That is an exception, not a rule. These protocols take time, and they do take time to go through. They are not suitable for everyone. And the nature of trauma processing, you sometimes have to find the right approach for people with regard to that. The nice thing is there are new protocols arising all the time within this. When I started out, there was just simply eye movements, and tapping on the back of the hands and making sounds in the ear. Here, with the advent of the online therapy, there are newer protocols that have been arising. One of the ones is called the butterfly hug. It's a protocol that was originally designed for groups and originally designed for groups of children after a hurricane devastated. I can never remember where it was. Is it New Orleans? I can't remember. But they developed the butterfly hug protocol, which works really, really well. There are many different protocols being evolved all the time. So it's just one of those elements that we need to just evaluate, and we bring in the new things whenever we can. So why are therapists choosing EMDR? Well, it's an ever-evolving way of doing therapy. It really is. There's all sorts of new findings, new connections. Those of you who've done ego state therapy or considering it, EMDR, ego state therapy, they are now looking at the fact that they are intersecting quite nicely, because in EMDR we look at a target or a node, central part of trauma, which they're now saying, well, actually they think that might be an ego state. So the two of them interlink, using it with CBT, using it with all sorts of other approaches. We are increasingly looking for evidence-based tools, and EMDR is heavily research. I will warn you, there is controversy out there, there is politics out there. There are people who say it doesn't work, there are people who say it does, and I'm firmly on the side of it does work because I've seen it work so many times. Clients like this approach, so they ask for it. And it is so adaptable. As I say, CBT, when you're working, or REBT, and when you're working with belief systems, you can bring EMDR in to work with that belief, with the belief systems. The psychodynamic work with going back in time, EMDR is a great one for working there, with integrative approaches of all types. And it is suitable for short-term and long-term work. So short-term therapy, brief strategic therapies, EMDR can fit into that. Yes, the protocols with a long-standing trauma can take a long time. But as I say, some of it might just be motivational work you're doing. Some of it might be weight management work, phobia protocols that we have. So it can be quite short-term as well as long-term. And the nice thing is there is clarity in the protocols out there. They are quite clear, they are quite robust. They are, when you first look at them, they look confusing, but there is a rhythm within them. That when you've done it a few times, you will see a very distinct rhythm with what is being done. So people practice very confidently and very safely. And it really does help people, clients, achieve really meaningful and lasting change. There's so much evidence out there with regard to that. And, I can only say the clients I've worked with have been very happy with the outcomes that they've got from very long-standing traumas they've held, going from really inhibited in the world out there to being able to sit there and think, what was it that was really upsetting me? So processing that out. So it is adaptable. It fits into a very integrative way of working. The so-called fourth wave of therapies are coming through. So part of the fourth wave is recognition of the more spiritual sides to people's evolution with problem resolution, but also with integrating different tools, different approaches together. Edges are blurring with a lot of the practices people are carrying out. Don't worry, if you're a hypnotherapist and just want to stick with hypnotherapists, still exceptionally valid, or CBT practitioner or an ACT practitioner, whatever it might be. But the way the world is going and the demands of our clients seem to be to bring in a more integrative approach, of which EMDR can be very, very central within that. Recognition here of people we've trained with, and we've got a very strong commitment to inclusivity and to collaboration, and these are just some of the areas in which we have been collaborating. We've been working with people. We've got people who are accrediting a particular course. So just to put that there for you.
Thank you
Thank you everyone.